Good morning, everyone. And welcome to beautiful St. Lucia, those of you who are visiting from neighboring islands and countries. My name is Jade Brown. I'm the Communications Officer attached to the Universal Health Coverage Unit, as well as the St. Jude Hospital Reconstruction Project. But for today, I will be your Mistress of Ceremonies. Of course, welcome to the Caribbean Regional Technical Workshop tackling NCDs and mental health. Before we commence, of course, we must stand and welcome God into the midst with prayer. So, in order to do that, I would like to I'd like to call on Dr. Sear, who will lead us in a word of prayer.
Good morning, all. Let's adopt a posture for prayer. Dear God and Father of mankind, we are so grateful for an opportunity to come before your throne. We thank you, God, for the life within us, for the opportunities that you've given to us so that we can make an impact on the lives of others. As we get ready to discuss and to find solutions, we ask that you will grant us wisdom and courage. Bless us, keep us. This is my prayer through Christ our Lord. Amen.
Ladies and gentlemen, please remain standing for the national anthem of St. Lucia, which will be sung by Miss Jadelle DeMarc of the St. Joseph's Convent.
Good morning. Sons and daughters of St. Lucia, love the land that gave us birth, land of beaches, hills and valleys, fairest isle of all the earth. Wheresoever you may roam, love, oh love, our island home. Gone the times when nations battled for this Helen of the West. Gone at last days when strife and discord deemed her children's toil and rest. Dawns at last a brighter day, stretches out a glad new way. May the good Lord bless our island, guard her sons from woe and harm. May our people live united, strong in soul and strong in arms. Justice, truth, and charity, our ideal forever be. Thank you.
Ladies and gentlemen, you may be seated. Honorable Moses Jabatis, Minister for Health, Wellness, and Elderly Affairs. Permanent Secretary of the Ministry of Health, Wellness, and Elderly Affairs, Ms. Jenny Daniel. Permanent Secretary of Trade and Commerce, Mrs. Sophia Henry. Dr. Tanya Dimitrenko, Dr. Edith Velenyi, Jumana, Qamruddin, Strategic Management Team of the Ministry of Health, Wellness, and Elderly Affairs. Chief Medical Officer, Dr. Sharon Belmar George. Country Program Specialist for PAHO, Mrs. Fiona Anthony. Clinical Directors of the MHMC and St. Jude Hospital, other staff of the Ministry of Health, Wellness, and Elderly Affairs, representatives from the Ministry of Agriculture, Fisheries, Food Security, and Rural Development, Ministry of Education, Sustainable Development, Innovation, Science, Technology, and Vocational Training, Ministry of Commerce, Manufacturing, Business Development, Cooperatives, and Consumer Affairs, Ministry of Finance, Economic Development, and the Youth Economy, representatives of the National Insurance Corporation, representatives from CARPHA and the OECS, representatives from the beautiful islands of Belize, Grenada, Guyana, and Jamaica, virtual participants, other invited guests, media fraternity, good morning. And welcome once again to the Caribbean Technical Workshop tackling NCDs and mental health. So ladies and gentlemen, without further ado, to deliver welcome remarks, I would like to call on Dr. Shanna Sir Filbert, NCD focal point of the Ministry of Health, Wellness, and Elderly Affairs.
Thank you, Ms. Brown. Protocol having been established, I wish to acknowledge the presence of our Honorable Minister for Health, Wellness, and Elderly Affairs, Mr. Moses Jean-Baptiste. I also wish to acknowledge our Permanent Secretary of the Ministry of Health, Wellness, and Elderly Affairs, Ms. Jenny Daniel. Also, our Permanent Secretary of the Ministry of Trade and Commerce, Mrs. Sophia Henry. Our representatives from the World Bank team, Dr. Tanya Dimitrik-Zenko, Dr. Edith Velenyi, and Ms. Jumana Qamruddin. Also, our Chief Medical Officer, Dr. Sharon Belmar-George, other members of the audience, and of course, persons visiting St. Lucia. Good morning and welcome. Ladies and gentlemen, it gives me great pleasure to welcome you to this very relevant and timely Caribbean Regional Technical Workshop. For those of you visiting St. Lucia for the first time, I wish you a very warm St. Lucian welcome. This week, we will be addressing an all too familiar and urgent topic, non-communicable diseases. More specifically, as the theme says, tackling non-communicable diseases and mental health. NCDs, non-communicable diseases and mental health conditions, have the ability to affect all of us. It is a sad reality to sit or stand in a room and realize that none of us is actually exempt from the impact of these conditions. What then is there to do? What options exist? The defiant movement starts with each of us. Our presence at this regional workshop is a testament to our willingness to be part of the change that we all so desperately hope for. Today's regional workshop is a precursor to the future NCD project which will be implemented in St. Lucia. The workshop brings together individuals from various countries, backgrounds, and areas of expertise. Today's engagement and the engagements that we will continue to have this week will allow us to see the impact of NCDs and mental health conditions on all, and on Caribbean nationals in particular. We will each, while listening to someone else or even ourselves, dig deep to find and vocalize collaborative solutions to solving this age-old and growing problem. Over the next 4 days, participants from various countries and regional organizations will have an opportunity to discuss and collaborate as we assess gaps, challenges, and opportunities in the area of NCDs and mental health. While we will work hard to develop appropriate roadmaps, I assure you that the task will not be onerous, but a combination of thought-provoking and creative exercises. We will even get opportunities to dress up and down. Sneaker Day on Wednesday and Country Color or National Wear Day on Thursday. We applaud the vision of the government of St. Lucia and the leadership of the World Bank in embarking on projects and programs which have given rise to this important event today. This event is the beginning of other great things to come in the area of NCD research aimed at guiding effective and strategic policy decisions in the area of NCD and mental health prevention and control. As we seek to explore concrete evidence-based pathways to targeting the prevention and control of cancer, diabetes, high blood pressure, cardiovascular disease outcomes like strokes and heart attacks, and chronic lung disease, to name a few, I leave you with the words of Henry Ford. Coming together is a beginning. Keeping together is progress. Working together is success. Let us continue to work together to achieve the success which is so needed in the area of NCD and mental health prevention and control. Thank you.
Thank you so much, Dr. Sear. And I'm sure you would agree with me when I say that she looks so lovely today in her orange. And those of you who are aware, today, of course, is Public Service Day, UN recognized date, and the theme for this year is 5 years to 2030, accelerating public service delivery for a sustainable future. And of course, good health is number 3 of the Sustainable Development Goals. And I believe that with conferences like these, we are well on our way to achieving that goal. So thanks again. Right now, I'd like to call on our permanent secretary. I say our because the Ministry of Health, Wellness, and Elderly Affairs, Ms. Jenny Daniel, who will be delivering her remarks.
Thank you. Thank you, Mistress of Ceremony. I wish to adopt the protocol which has been established here today and to bid all distinguished ladies and gentlemen a pleasant Monday and good morning. The growing concern over the prevalence of non-communicable diseases, or NCDs, in St. Lucia and the wider Caribbean is a major public health issue that has significant social, economic, and healthcare implications. Non-communicable diseases, such as cardiovascular diseases, including heart attacks and strokes, diabetes, chronic respiratory diseases, and cancer, are now the leading cause of death and disability across the Caribbean. According to the Caribbean Public Health Agency, CARPHA, and the World Health Organization, WHO, NCDs account for approximately 70 to 80% of all deaths in the region. This represents a significant disease burden and one which is untenable, as it may in the future hinder social and economic development of the countries in the region. The key factors contributing to NCDs in the Caribbean are primarily lifestyle choices, and these include poor diets that are high in salt, sugar, and fats, a lack of physical activity, excessive alcohol consumption and tobacco use, obesity and overweight, urbanization, and socioeconomic conditions. Also, cultural and social norms, and these norms include food-related traditions and social norms that often encourage overeating, unhealthy food choices, and unsafe practices. And I'm sure we can think of a number of those social norms and festive days, we call them, within our culture. In addition, a low level of awareness of the risks and prevention methods for NCDs is also a contributing factor. The prevalence of NCDs in St. Lucia continues to place increased strain on limited healthcare resources. The economic loss resulting from high treatment costs, lost productivity, and early deaths will eventually hinder the progress and economic development of the country, resulting in a reduced quality of life for everyone. The government of St. Lucia, and simultaneously the Ministry of Health, Wellness and Elderly Affairs, is acutely cognizant of the current and potential impact of NCDs on the country's population and on the healthcare system. Therefore, a number of initiatives have been implemented through the Ministry of Health and with the support of our vital stakeholders, including the Ministries of Finance and Equity, the National Insurance Corporation, and other public and private sector partners. Primarily, there is a commitment to local and regional health policies that guide the government's strategy and actions that would result in the reduction of NCDs. Such commitment was initiated through the Port of Spain Declaration as early as 2007. Subsequently, the government of St. Lucia launched various universal health coverage initiatives directed at providing the requisite treatment, protocols, and medication at no out-of-pocket cost to patients requiring treatment for diabetes in the first instance, and lately in 2023 to hypertensive patients. At this time, the Ministry of Health, Wellness and Elderly Affairs is strategically poised to achieve its vision to improve the overall health and wellness of the population of St. Lucia through the implementation of Universal Health Coverage, or UHC. The implementation of UHC, by its very nature, has been focused on the primary healthcare approach to the delivery of healthcare services. This approach is founded against the principles of health promotion and prevention that would facilitate early detection and the treatment or prevention of poor outcomes of diseases. The incremental implementation of UHC has to date emphasized the necessity of early detection and treatment of non-communicable diseases and their impact on maternal and child health. Additionally, the essential package of services offered through the UHC currently includes cervical screening, prostate screening, and very recently, we launched the breast cancer screening program. Through the government of St. Lucia, through financing provided by the World Bank Group, has also sought to strengthen the capacity of the healthcare system to reduce the occurrence of NCDs and to improve the national health profile. The implementation of the Health System Strengthening Project, as well as the OECS Regional Health Project, are testimony to the continued efforts to reduce the impact of NCDs on the country. The performance-based financing component of the HSSP has attained significant headway in reforming the protocols and methodologies utilized within the healthcare sector and is specifically targeted at reducing NCDs. This project has included a heavy training component aimed at equipping our healthcare providers with unique and specialized capacities to manage NCDs in primary health care. The government of St. Lucia has also partnered with the government of China on Taiwan in developing and implementing over the past 2 years an NCD project aimed at strengthening the capacity of the healthcare sector to prevent, diagnose, and treat NCDs within the primary healthcare environment. In order to facilitate the development of a pathway towards the reduction of the impact on the impact of NCDs, the government of St. Lucia has also appointed an NCD commission. It is anticipated that this commission will work with the Ministry of Health to develop the requisite strategies and policies in this regard. Therefore, it is fitting that at this time, St. Lucia, alongside the other islands in the Caribbean region, embark on the implementation of this NCD project, and this workshop here today is the start of it, in anticipation that we may be able to stem this flow of NCDs that are eating away at the health of the population and potentially reducing the developmental prospects for the future. The Ministry of Health, Wellness and Elderly Affairs is pleased with the emphasis placed by the government on this component of healthcare delivery and looks forward to continued support and progress in this regard. Simultaneously, we wish to thank our partners in health at the World Bank Group for the continued support and guidance as we embark on this journey. In conclusion, the rise of NCDs in St. Lucia, as well, of course, including the mental health component, is a serious and urgent public health challenge. Combating NCDs requires a multi-sectoral approach involving government, civil society, healthcare providers, and individuals. Prevention, early detection, and lifestyle changes are critical to reversing current trends and ensuring a healthier future for the population of St. Lucia. I must note that this is not an easy process, but in the journey of 1,000 miles, every step is significant, every step matters. I wish to welcome all participants to the workshop here today and during the week, and I wish you all a successful and exciting workshop. Thank you very much.
Thank you for that, P.S. Daniel. And I'm sure you heard that last line. In a journey of 1,000 miles, every step is significant and every step is important. In St. Lucia, we have a Creole word called largesse. And I believe our PS knows our people very well. We love to eat well, we love to drink well, we love enjoyment. But I think the message from her remarks would be everything but in moderation. Okay, moving forward, on behalf of the World Bank, delivering remarks on behalf of the World Bank, I'd like to welcome Dr. Tanya Dmitrichenko, Health Practice Manager for Latin America and the Caribbean, World Bank, for the World Bank, sorry.
Good morning, colleagues, Honorable Minister, and Permanent Secretary. It's really a pleasure for me to be here today, and on behalf of the World Bank, it's an honor and really a privilege to be opening this very important 4-day workshop, regional workshop on tackling non-communicable diseases and mental health. We wanted to really extend our very deep thanks to the government of St. Lucia, especially to the Ministry of Health and Wellness and Elderly Affairs for hosting us in this beautiful island, in this beautiful space, and also for participating in earnest. We have participation from a wide range of sectors, and it's very impressive. I also wanted to thank all the countries that have made the trip to come to St. Lucia from the region, and also from the OECS countries, Jamaica, but also Belize, Guyana, who have come from the continent to join this event. Your presence and leadership really reflect the urgency and a shared commitment to this conversation. As many of you know all too well, the Caribbean countries carry one of the highest burdens of non-communicable diseases in the world, with over 75% of deaths in the region attributable to non-communicable diseases. What I find even more alarming is that 40% of NCD deaths occur prematurely, before the age of 40. So we're losing people in their most productive years. And in the World Bank, we're always encouraging countries and talking to them about the importance of investing in human capital. But as the pandemic has showed us, and as these figures show us, that all our investments in education can be lost in a second if people die prematurely from non-communicable diseases or are too ill to participate actively in the workforce. Another alarming figure to me is that since the turn of the millennium, in non-Latin countries in the region, we've seen a 38% increase in loss in disability-adjusted life years and healthy life years. So the problem is only getting worse. Countries in the region face a triple threat of diabetes, hypertension, cancer, and chronic diseases place an enormous strain not only on health systems, but also in families, in the economy. a recent World Bank report showed that NCDs cost 1.4 to 8% of GDP in the Caribbean countries. So this is an enormous loss. As my colleague, the Minister of Finance of Guyana put it so well, investing in resilient health systems is indispensable to creating resilient economies. So this is not just a matter of health. This is something that needs to be embraced across sectors and in order for countries to have a healthy and growing economy. But this event is not just a reflection on the challenges. It is also a testament to the momentum building across the region to do something about it. And I think and hope that we can focus our attention in the coming days, not on the problem, but in finding the solutions. Over the past year, the World Bank has had participated in we've had together several joint initiatives, including a dialogue of Caribbean ministers of finance at the World Bank annual meetings last October, and more recently during our spring meetings in April, a high-level health panel with participation from the Minister of Finance of Grenada, and that was chaired by the World Bank Vice President Ajay Banga. And the message is clear that the time for action is now. And that's what brings us to St. Lucia this week. This workshop is a culmination of these conversations and a springboard for co-producing a practical, action-oriented roadmap. Our aim is to support countries and regional partners in developing concrete, country-driven steps to scale up the response to non-communicable diseases and mental health, through strengthening primary care, health systems integration, and stronger regional coordination. We are especially thankful and grateful for the participation of key regional partners, CARFA, the ECS Commission, CARICOM, civil society leaders like the Healthy Caribbean Coalition, and the Pan American Health Organization. This leadership is vital in ensuring that this work reflects not only the technical needs, but that it is also reflects the realities and the priorities of the Caribbean people. Over the next 4 days, we will engage. Unfortunately, I'll only be here today, so but you will engage in highly interactive sessions built around your lived experiences, system-level challenges, and ideas for change. The goal is really to ensure that any strategies we support are locally relevant, operationally feasible, and geared towards expanding quality services for NCD and mental health, two areas where the goal of universal health coverage remain most elusive. We also hope this week will offer more than just a technical roadmap. It is a chance to deepen our professional networks, strengthen our partnerships, and most importantly, to build friendships. Because tackling something as complex as non-communicable diseases and mental health will require trust, collaboration, and the kind of solidarity that is rooted in mutual understanding. At the World Bank, we are committed to supporting this region and building on the foundation of our ongoing work. And we have the regional OECS Health Project, the Guyana One Health Project, as well as collaborations with the Pandemic Fund Financed Initiative in collaboration with the Pan American Health Organization to strengthen preparedness and response to emergency threats, as well as the Pandemic Fund supporting the One Health Initiative in Guyana. Our teams are here to listen, to learn, and to work with you on building a healthier and more resilient future. once again, thank you for being here, for making the trip, and to our hosts, thank you for setting the stage for what I am confident will be a very productive and inspiring week. So let's make the most of it together.
Thank you so much, Dr. Dmitrichenko. And as she spoke about deepening professional networks, I implore you to deepen cultural ties. So Guyana, Jamaica, Belize, and those of you coming from further afield, it is my esteemed pleasure to welcome Shivani Aurelie, who will be delivering a cultural performance at this time. Thank you so much, Shivani. Moving forward, I'd like to call on Dr. Edith Velenyi, Senior Health Economist, Team Task Lead for the World Bank.
Thank you so much. And this is a hard act to follow. Sky, I would like to try your instrument. It's very intriguing. It's a pleasure to be here indeed. The protocol has been established, but I would still like to recognize Honorable Moses Jean-Baptiste, Minister of Health. A pleasure to see you, Minister. P.S. Jenny Daniel, thank you so much for all the work and the support from your team. Of course, I'm very happy that my manager, Tanya Dimitrochenko, could join us on this journey. And thank you so much to all the dignitaries, all the officials in the room. I really am pleased because looking at you, you will laugh at me, you're a dream come true for me. I would like to welcome you on behalf of the organizing team. This is a joint production with the global team. Jumana Qamruddin is the lead for that. And on behalf of this joint organizing team, I would like to welcome you to this very, very important event on NCDs, Caribbean Regional Workshop on NCDs and Mental Health. And the reason I said that your dream come true, because with Jumana, we have been scheming over the last half a year, how do we bring this event to the Caribbean? And so we are here with you, and I'm very pleased to see the faces in person to get this going. Needless to say, we are especially grateful to the government of St. Lucia and the Ministry of Health, Wellness and Elderly Affairs for the leadership in hosting this event. Thank you so much to everybody, including Dr. Sear, Dr. Eugene, all the comms team behind this event. We really appreciate your commitment, your hospitality, and the leadership on this event. This obviously sets a very inspiring tone for get us going with this journey and really make one more step in this mile. We all recognize that NCDs and mental health represent a common challenge in the Caribbean, and it's not only for the health system, but as it has been emphasized already, it is also impacting your economies, your society, and your future development. The scale of this complexity, the numbers that you have heard from the PS and Tanya already, it really shows that this challenge requires all hands on deck. And what we mean by all hands on deck is definitely a multi-sectoral engagement with all ministries of one government approach, including regional partners to really buy into and support your agenda on NCDs and mental health. And it really requires a future-oriented, integrated planning and delivery. I think these are really important to have the impact that you're searching for. This is why we're here today. The intent of this event is really co-producing with you a roadmap, and this roadmap should be something that is signaling or marking your journey on UHC, with special focus on the NCDs and mental health agenda. We would like to have not just a roadmap, because it's easy to create a roadmap, but it's really come up with a concrete action plan in terms of how to operationalize it. And I would like to underscore it, because I know that in the Caribbean we have a lot of brilliant plans, but what I hear very often from the participants is we need action, not just plans. And so our goal here is really not just a dialogue. It's not just producing a roadmap. It really is focusing on delivery. It is focusing on transformation through scalable solutions tailored to the unique context of the Caribbean. So in my view, this workshop really represents a platform to accelerate this agenda. And this really brings together the opportunity that the World Bank, hand in hand with the regional partners and organizations, can move the needle on this topic. Needless to say, we are not just coming here just to discuss things, but we really believe that the power of a network, the power of connection, human connection, really can make things happen. So we want to invest in our network, in our partnership, in our friendship with you over these next coming days. And in closing, I really would like to just again thank you, St. Lucia, for your visionary leadership on NCDs. You're pushing it in your country and also engaging with other countries to make regionality happen. I also wanted to thank all of the participants from the countries traveling this far, all the regional entities, OECS Commission, CARICOM, CARFA, Healthy Caribbean Coalition, and PAHO for working with us on this journey. And let's make these next few days do work. You know, we really need to have right ideas, bold actions, deepening the partnership and friendship, and having a shared commitment towards mental health and the NCD agenda. Thank you so much for being here with us.
Thank you so much, Edith. I would like to call on the Global Program Lead for Healthcare Delivery and the World Bank, Jumana Qamruddin.
Good morning, everyone. Honorable Minister Baptiste and Permanent Secretary Danielle, it's a true honor to be here today. On behalf of the World Bank's Global Engagement Unit for Health, Nutrition, and Population at the World Bank, I really want to thank you all for being here. And really, in Dr. Sears' prayer today, I was just thinking what a privilege it is for all of us to be here and really commit to the work that we're doing. And so I really wanted to thank you for bringing that into the discussion this morning. I want to begin by acknowledging the world that we live in today, a world defined by high complexity, rapid change, and great uncertainty. From health to climate to economic resilience, we're navigating truly uncharted terrain. In this moment, while the challenges are many, the need for transformation is even greater. There's a growing recognition that incremental progress is just no longer enough. The pace and scale of change required demand a bold shift in how we think, work, and lead. And here, in this region, the bold leadership on tackling non-communicable diseases and mental health conditions offers a powerful entry point. It is not just about addressing urgent health needs. It is about using these priorities as a lever to accelerate the transformation of public health systems, public health systems, and beyond. For systems that are more integrated, people-centered, and resilient, for systems that can enable and sustain better, more equitable health outcomes today and into the future. But accelerating transformation in today's world can be truly daunting. Where do we start? As Edith and other colleagues have said this morning, we start by drawing on our collective intelligence as an invaluable resource, on the wisdom that comes from working together across countries, across sectors, across disciplines. We build on the power of networks of people, committed to a shared goal, as we have here today and in the region, and we tap into the potential of global platforms. The priorities of the region on NCDs and the NCDs and mental health agenda align with the World Bank's global commitment to working with countries on reaching 1.5 billion people with quality, equitable health services by 2030 as a contribution to the agenda on universal health coverage. This week also aligns with the World Bank's broader effort as a knowledge bank in creating space for countries to come together to learn from each other, to collaborate with key stakeholders, and to glean insights from the global knowledge agenda in accelerating development impact. We're looking forward to an exciting week and to partnering with you to take forward the important work ahead. Thank you again for welcoming us, and deep appreciation to our hosts, the government of St. Lucia, and just really looking forward to kicking this off. So thank you, everyone.
Okay, ladies and gentlemen, we would like Honorable Moses Jabatis to close the ceremony. So therefore, we are going to have another piece of entertainment, this time from one of our soca monarchs. His name is Alpha Ale. He has many, many, many wonderful songs, and I'm sure he's going to do a great job delivering that to you all. Oh, okay. Well, we'll move forward. So, Honorable Moses Jabatis, your time is up.
Thank you very much. Good morning, everybody. Bonjour tout le monde. Avec bienvenue Saint Lucie. Welcome to St. Lucia. I wish to take this opportunity to recognize our permanent secretary, Ms. Jenny Daniel. Also, I wish to recognize other permanent secretaries who are here today. I want to say good morning in a very special way to Dr. Tanya. Dr. Tanya. Well, I also want to once again say hello to Dr. Edith Velenyi. Dr. Edith is a St. Lucian by proclamation. She's our very good friend, always here, and we love to have her every time. Jumana, Qamruddin, and also I wish to recognize our CMO, our Chief Medical Officer, Dr. Sir, our Deputy Permanent Secretary, the other officials from both the St. Jude Hospital, Medical Director, and also the Millennium Heights Medical Complex, so in King E. Hospital, other officials from the World Bank, team, the OECS, other professionals who are here from all of the ministries, invited guests, Dr. Eugene, who's the head of our Universal Health Coverage Unit. I see the nutritionists, the finance people here, individuals from the NIC, National Insurance Corporation, and other organizations. We also have representatives from CARICOM and so on. Welcome, everyone. This morning, I wish to speak with you briefly, and I also wish to apologize for the absence of the Prime Minister and Deputy Prime Minister. In fact, Deputy Prime Minister Dr. Ernest Hilaire was on his way, and Prime Minister called him to discuss some matters. Prime Minister will be leaving the country in a couple hours, and we have a very special cabinet meeting which is about to start in about 10 minutes. And he asked me to please convey his regrets. I wish at this time to join everyone who spoke before me to indicate that non-communicable diseases, NCDs as we know it, really is a very serious matter for the Caribbean and indeed the world. We know that NCDs remain the leading cause of death worldwide, and this is also true for the Caribbean. As you've heard before, an estimated 75 to 80% of deaths are due to NCDs. The findings from the most recent population-based World Health Organization stepwise approach to NCD Risk Factor Surveillance Survey, or STEPS, in 2020 concluded that from a representative sample of the St. Lucian population aged 18 to 69 years old, 65% were overweight or obese. 65%. 46.1% females and 20.6% of males were obese. The percentage of persons with raised blood pressure was 39.4%, while those with raised blood glucose levels represented 15.9% of the sample population. Recognizing the tremendous socioeconomic threat posed by NCDs, the government of St. Lucia has made concerted efforts to address NCDs and the risk factors. In 2005, the National Strategic Plan for Health was developed, highlighting chronic non-communicable disease prevention and control as one of its priority areas. In December 2008, the Cabinet of Ministers endorsed the CARICOM Heads of Government Summit conclusion on non-communicable diseases. We call it the Declaration of Port of Spain, uniting to stop the epidemic of chronic NCDs. The Cabinet further committed itself to the establishment of the St. Lucia Commission on Chronic NCDs. In 2017, the Ministry of Health, Wellness, thank you. In 2017, the Ministry of Health and Wellness, along with PAHO representatives, established a national chronic disease policy. The aim of this was to ensure that there is multi-sectoral participation and for all to adopt an all-of-government approach, all-of-society approach to NCD prevention and control. Since 2006, the government embarked on its journey of providing universal health coverage for all St. Lucians. However, over the past 2 years, there has been an increased focus on the attainment of this dream. To date, as you heard before, the Universal Health Coverage Initiative, NCDs, through the Universal Health Coverage Initiative, NCDs such as hypertension, diabetes, and cancers are included within the essential package of health services. These services include screening and treatment for hypertension and diabetes under the current performance-based financing pilot project. Breast cancer screening, HPV testing, and prostate cancer screening are part of the services under men's health services and other services that have been developed through the Universal Health Coverage Unit. Just last week, as Permanent Secretary indicated, we launched new services for breast cancer screening. And in St. Lucia today, anybody who wants services in breast cancer screening can go to the Wellness Center. We have, through the World Bank, through the generous contribution of the World Bank, we purchased 2 brand new mammography machines and installed them at 2 of our hospitals so our people can get services at no cost to them. And if there are additional investigations, biopsies, and so on, the government will also pay for these services. So no cost. And through these initiatives, we continue to see an increase in the number of men and women who are accessing services through universal health coverage. All of this is happening within the ambit of this one health approach and one objective approach, meaning we are all working towards universal health coverage, and all the departments within our ministry, through the office of the CMO and all the other departments, are working together to ensure that we achieve this dream. I also want to thank the World Bank, especially Dr. Edith and her team, for the work which we have done with the help of the World Bank with the performance-based financing strategy. I want to tell you, Dr. Edith, that over the last 2 weeks, the Ministry of Health, together with the Ministry of Finance, have been working with Cabinet through their voices and through a Cabinet memo to see how best we can expand the services of the PBF and to see how best we can include the PBF as a strategy for primary health care. Our discussion started last week, and I can guarantee you it will continue this week and the following week. Our aim is to expand the services of the PBF, the strategy in primary health care, and we are also working to ensure that we bring legislation to Parliament to cause there to be a very serious methodology through which we implement universal health coverage. In St. Lucia, we have been talking about universal health coverage for a very long time. But this year, we are hoping to take legislation to Parliament. We are also working to change our health information system to ensure that there's interoperability and to ensure that we do what we must for efficiency and to ensure new services are rendered to our people. Today's workshop, therefore, is very timely, leveraging primary health care and this network approach to tackle NCDs and mental health in the Caribbean. It's very timely because we need to find not only multi-sectoral approaches, but we need to find ways to cause Caribbean culture over time to move towards better lifestyles and better health. Many times when I speak to individuals, whether it be in agriculture or health, I was a minister for agriculture some years ago, and we spoke a lot about how do we cause St. Lucians to eat better and to eat well and so on. And I've said many times the answer is really in culture. It's not only in technical papers and so on. So I'm hoping that over the next few days you can possibly have a discussion on culture. How do we cause Caribbean culture, St. Lucian culture, to integrate into this healthy eating and healthy lifestyle habit? I want to thank the ministry and the staff over the years. There have been several activities to encourage St. Lucians to eat better, to walk, and so on. And then I notice many businesses and organizations, they are no longer waiting for a call from the Ministry of Health. And almost every single week, there are activities, whether it be the men's health walk, which took place on Sunday. I'm so sorry I couldn't attend, Dr. Sir. Or whether it be an exercise session, whether it be Calypsonians and so on who are getting into it. Last year, there was a Calypsonian who sang a wonderful song, exercise and so on. So slowly, we are beginning to see change. And I continue to argue that it's all about culture. It's all about culture. And if you read, those of you who are better read than I am, I'm sure you will agree that all of the civilizations of the past, even with technology, it's really about culture. So you can develop all of your technology, you can build all of your hospitals and so on. And if your culture doesn't change, then you continue to have problems. So I'm hoping that the discussions will lead us to a point where we come with ideas or develop ideas which can guide policymakers over the next few generations and decades. Because we do have a very serious problem. And it's not only crime and so on. We have a very, very serious problem if we continue down the path that we are going. So it's for me to thank all of the experts who are here, and those of you from the region, whether it be Jamaica, Belize, wherever you are from. I really want you to spend some time and look at this Caribbean civilization and how do we, over time, cause our people to appreciate that, you can't grow if you're not healthy, as simple and as cliche as this may sound. So I welcome you to St. Lucia. I urge those of you who have never been here to find some time to visit Soufrière and Vieux-Fort and the other parts of the country. And I wish you well. I really hope we develop strategies, strategies that can work, like the PBF and so on. That we don't come to workshops simply to regurgitate or to have papers discussed and so on, that we find actual solutions. We are going to spread the PBF throughout all of our wellness centers. These are actual lessons. And we learn and we are going to implement. We are going to achieve universal health coverage. And we, as a government, we said, hey, we can't do everything one time, but we're going to start. So we started to implement, moving from discussion to implementation. And we have the results to show that X% of more ladies are visiting the wellness centers, X% of more men are going to the men's clinic, and we can tell you how many more men are accessing prostate cancer screening that they don't have to pay for in St. Lucia since we started our services, and so on. So actual results that you can measure, you can report, you can learn from, and then we can move forward. So I will run to the cabinet and tell the Prime Minister of this wonderful event, and we are hoping to learn from your experiences. And when you come to St. Lucia next year, around this time, maybe I will report or somebody else will report what is happening here. But we are very excited, we are very positive here in St. Lucia about the partnerships with World Bank and with the region and so on. We're very positive about what we're doing. And I want to thank all of you for your support. So thank you very much. And I don't know if you'll allow me, but I want to seek your permission to go to the cabinet meeting. Can I go? Thank you very much. Thank you.
Thank you. Thank you so much, Minister. And just before you leave, I believe that we have a gift for you.
Thank you very much. To the Prime Minister. Okay, thank you very much. All right. Okay. Thank you. Thanks very much.
And Minister did such a great job at explaining universal health coverage and everything that has been achieved that I don't have to do my usual plug whenever I host. I must talk about UHC. He says I should. But of course, we have 5 services, right, Doc? 5 services that have now been launched under UHC. One being maternal and child health, where women can access ultrasounds as well as their labs at no cost. Then we also launched cervical cancer screening, and many women are accessing that service as well. Then we went on to the men because they were saying, oh, you all are forgetting about us. So we relaunched the men's health clinic, and that is really an amazing one. You find that the men profit the opportunity to socialize and gain a sense of community. They have cookout competitions, and you know, they're really there for each other. That's what we've noticed with at the primary health care centers, as well as snake bite management. And that was an interesting one. We have the featherless snake, which is one of the most venomous snakes in the world here in St. Lucia, indigenous to St. Lucia. So we launched snake bite management. And recently, as in last week, we launched mammography, breast cancer screening and mammography services. And of course, we're getting a lot of attention for that as well. Many women and men are interested in that. But just one thing I'd like to say to our viewers at home, and to those of you who are here local as well, please do contact your nearest wellness center to access the services, and do walk with a valid ID. It is very important, so says our director, Dr. Alicia Eugene Ford. Moving on, of course, we are in the Helen of the West Indies, and Minister recently, a minute ago, mentioned he wondered how can we get people to live a healthier lifestyle. And one way that I would suggest, and I love, and I know most of us are from the Caribbean, and those who are not, you visited, so you know we love to dance, and we love to sing, and we love a party. So at this point, I would like to welcome Arthur Allen. He's an extremely versatile artist, and he's best known for his 5-time groovy soca winning hits. So Arthur is here with us. I invite you, if you'd like to get on your feet, let's do that.
Yes. Good morning, and like we say in St. Lucia, somebody say Saudi. That's what you say. All right, just give a little clap for something. You want to play the energy. You've been sitting down and relaxing all morning. So we feel happy. Give a little wave now. Come on, say happy is happy is happy. Oh yes, everybody wave with me. Say happy is happy is happy. Oh yes. But listen, say life's sweet. I ain't rich, but I'm blessed. You know what? So I'm feeling irate. How you feel? I'm feeling irate. Tell them again, life's sweet. I ain't rich, but I'm blessed. Come on. So I just want party. What do you want to do? I just want party. All right, we're nicing up the vibe. I want to say a wonderful, wonderful morning once again to you guys. If you're thankful for life, say aye. Yeah, we mash it up again. Anybody gonna be back for St. Lucia Carnival? Make sure you come. One more time, feel I can mash it up again. Yeah, yeah, yeah. So let me do this one more time, one more time, one more time. You gotta give praises, one more clap. Give praises, yeah, for all the positives, even the negatives. Give praises, yeah, for all the memories, even discrepancies. Give praises, yeah. Put your hand up in the sky, wave it up, shake it up. Give praises, yeah. Put your hand up in the sky, high, high. Listen, give thanks for every show, 'cause you never know, it could be the last one that you go. And give thanks for every vet, but never forget, it could be the last one that you fed. Sweat, come on, so we might just link up. Then we neighbor, when the pressure build up, we don't want no fighting in there. Go find a partner, and the two of you just free up. Don't wait until your time up busy, but it's better the answer. Give praises, yeah. Come on, for all the positives, even the negatives. Give praises, yeah, for all the memories, even discrepancies. So give praises, yeah. Put your hand up in the sky, wave it up, shake it up. Give praises, yeah. Put your hand up in the sky, high. Now one more. Anybody proud to be West Indian? Say yeah, yeah. Yeah. I'm proud to be St. Lucia. Any St. Lucians here? Yeah. I'm gonna listen to the West Indian version, you know. I am a West Indian, yeah. Well, that's who I am. Let's give my nice slow wave. When that place is sweet, melodies in the heat, and everybody's on the road, jumping for one gold. To any song I play, our culture on a display. Everybody say that we find a special way to see the people playing. Everybody celebrating. The music sounds so sweet. It's only we who feel it. Well, I'm proud of where I'm from, and if you are truly proud, one more time, everybody put your hands together, clap for the West Indies. Everybody, thank God that I am a West Indian, and I come from the land of sun. Let me hear you thank God that we come from the Caribbean, where the Qamruddin live, so we want hands up together. Let me see your hands up for soca music, for the greatest festival. Hands up, cause all of we are one. If you are a West Indian, start the party up in there. Caribbean people everywhere, raise your flag up in the air. If you are a West Indian, thank you very much. Somebody say Saudi. Yes. My name is Alpha Ale.
Thank you so much, Arthur. Thank you, Arthur. That was amazing. You wouldn't be in the Caribbean if we didn't add a sprinkle of Bacchanal in there. And as we draw to a close, I would just like to thank everybody for attending, those of you virtually, those of you at home, and those of you with us who have traveled so far and wide to come to St. Lucia for the Caribbean Regional Technical Workshop on Non-Communicable Diseases and Mental Health. So I do hope that it is a wonderful, wonderful week, inspiring, innovating week for you. And as we end, I'd just like to say something very important. We do have refreshments available. Okay, ladies and gentlemen, have a wonderful week.